All right. Good evening, everyone. I'm Dr. Preeti Singh, and I'm a senior consultant clinical psychology and psychotherapist. And I'm here to welcome you all on behalf of Listen. And as we celebrate this whole week as International World Mental Health Week, and this being our fourth major event of the week, we chose this topic about role of mental health in long-term patient care. And so I welcome all the panelists, and I'm so excited to have you all here and start the conversation, and have takeaways from each one of you. So the purpose is to understand the need for mental health, the level of ignorance we have about mental health in terms with the patient and professional to some extent, and the barriers leading to these problems of not having an access to mental health, and how on the whole we can contribute or at least add some value as to how we integrate the mental health care needs along with the physical health care needs. So we will get started. I'll quickly introduce all the panelists once to our viewers and audience. And let me start with Kamal. He's the first. Kamal is the co-founder of NephroPlus, and it's one of the India's largest dialysis network we have. Kamal has a background of chemical engineering, and he has developed softwares for products of Apple's for almost 10 years before he co-founded NephroPlus. And now, why we have Kamal here is also we have another reason is Kamal has been diagnosed with stage 5 chronic condition 24 years back, and he's been on dialysis for last 24 years. And he has an incredible narrative. When I was reading his blog and I went to his website, and how this NephroPlus came up, all of this journey has been extremely overwhelming, inspiring, and I just felt that this narrative needs to reach to a lot of people out there. So yes, I guess we will get back to Kamal with a lot of more insight that he'll have to share with us. Then we have Vijay. Thank you. Welcome. And then we have Vijay, and Vijay has been a cancer thriver and survivor, but more than that, he specializes in the area of strategic consulting. He into leadership development. He's into group training, individual coaching, counseling, and a vast corporate experience of 30 years, both in India and overseas. And he brings a lot of holistic approach when he's counseling towards his, the patients who are, diagnosed with, conditions like cancer or other life-threatening disorders for that matter, and their caregivers. He's really integrating a lot of it with his own experiences, I'm sure. And he's also an author. Cancer, and it's called My Cancer Is Me, the journey from illness to wholeness. And I guess we will love to know more about it when we get back to him. And he runs cancer coaching program. I'm quite intrigued to know about that as well. So we'll come back to you, Vijay, on that quickly. And then we have Dr. Satinder Pal Singh, and he is the founder and director of Synergy Clinics, which specializes in pain management. Dr. Singh has done his PhD in pain management from Sydney, Australia, and he specializes in sports medicine, which he studied from Harvard Medical School, USA. And at Synergy, they provide the patient with the best pain management and rehabilitation services, and it has the history of delivering international standard care to the patient. So quite excited to know more about it, Dr. Singh, I think, and we'll get back to you on that. And yes, we have Dr. Piyush. Dr. Piyush is an Associate Director, Surgical Oncology in Paras Hospital, Gurgaon. And he has more than 12 years of expertise in managing oral cancer, gynecological, and urological cancer with minimal invasion. He is extensively trained on oncoplasty of forehead and neck region, and he continuously strives to deliver the superior outcomes without compromising oncology principles. And he has a very patient-centric approach while he's treating the patient, and he integrates the family care equally. Well, we work as a team in Paris, and I have really seen him collaborating with the Department of Behavioral Medicine as much as needed, for that matter, for his patients. And then we have Dr. Vinay Saini. He is a psychiatrist, consultant to Civil Hospital Gurgaon, and he is a pastor from Nimhans, and he runs the district mental health program here in Gurgaon, and he is also running tobacco cessation program also in Gurgaon. He is very, very active in spreading awareness about mental health and the mental illnesses, for that matter, and very inspiring. And he's very proactive the way he integrates all the biopsychosocial elements when he's treating his patients. So I guess with that, thank you, Dr. Vinay, for joining us. I would again, thank you everyone for joining us here. And now let's get kick-started with a lot of things that I want to ask and I want to hear from all of you, for that matter. So we'll start with Kamal. So Kamal, yes, you have, I have read your blogs. I told you that. So, and I was reading on that you said that kidney disease is as much is physical as much it is psychological. Would really want to hear more on that. Could you please tell us?
Yeah, no, thank you so much, Dr. Singh and Krishnaveer, for having me here. Kidney disease is a physiological disease, we all know that, but I believe that there is an undeniable, a very major psychological aspect to chronic kidney disease, especially the one that leads to kidney failure and that requires the patient to either get a kidney transplant or be on dialysis or get the conservative treatment. So either one of these therapies, there is a huge psychological impact. We are not honestly used to losing any of our organs, and the kidneys are one of the most sensitive organs, the first to shut off if there is any shock to the body and so on. And it's a very widely prevalent, 1 in 10 have kidney disease, estimated prevalence shows. Now, it comes as a huge shock to somebody to know that they need to be on dialysis or they need to get a kidney transplant, and their entire life turns upside down. They have a lot of, and these days, many young people are getting onto dialysis or requiring a kidney transplant, because of which their aspirations, their dreams are shattered, their entire life turns upside down, and not only theirs, the entire family. And there's a huge, challenge in terms of the financial expenses as well, because especially in countries like India, where most people bear a lot of their expenses out of pocket and are not covered by government insurance or private insurance, it's a huge psychological burden that an individual feels that they are being a burden to the family, because a lot of money, 25,000-30,000 rupees a month at least, is being spent on the treatment of one person, when barely can anybody afford. Even if you look at middle class families, right? For them also, it's a huge burden, the financial burden. So people lose interest in life because they feel that, what is this kind of life that I'm leading? And they become very depressed and they lose the willingness to live. That has a very big impact on the physiological aspect of the disease. People stop going for dialysis, or they don't go for the required treatments. So this whole psychological part has a big impact on the physiological part as well. That is what I meant when I said that it has a psychological aspect as well.
Right. So I guess, I guess very rightly said that, the impact, the loss, the grief, so much comes up when the diagnosis happens itself. And then there is a lot of uncertainty about how things are going to unfold for you.
Yes.
And I guess that does need some hand-holding in the process at times.
Absolutely. A lot of hand-holding, because, the people need support. They don't know how to deal with this kind of shock diagnosis. They don't know how to manage their depression. They don't know how to lead a positive life. It is possible. The it is more of a societal thing, especially in countries like India, where people think that kidney disease is matlab end of life, khel khatam, dukan band. So it's very
Absolutely right.
unfortunate though, but like, look at me, like I'm 24 and a half years on dialysis, and I
Yes.
intend to go on for much longer, right? I lead a completely normal life. I swim every morning. I work full time. I'm running a network of 275 dialysis centers, 3 countries. It's not easy. So the point is, it is possible, but unfortunately, people give up. That is the saddest thing. And it is not the sad part, especially in our country, is that people don't give the psychological part that much attention that it deserves, and it can actually improve outcomes to a dramatic extent. Because when somebody loses the willingness to live, or somebody loses the proactiveness needed to deal with a kidney disease or to deal with dialysis or kidney transplant, their entire outlook to life changes, and that has a very negative impact on the actual physiological outcomes as well, right? So it is quite evident that people who are more proactive about their disease, they tend to do better on kidney disease, right? When they look at it in a positive manner, they go back to work, for example, they take up exercise, for example, that leads to much better cardiac health. So all these things feed off each other, and it's a positive reinforcement loop that can be created, and unfortunately that goes completely the other way, where it becomes a negative reinforcement loop, and one thing leads to another, and then before you know it, in fact, if you look at mortality figures in dialysis, it is very, very high in India. Like in our own data shows that the 5-year mortality is about 50% for dialysis patients, which means that half the patients are dying in less than 5 years, which is very bad, and it doesn't need to be that way. Right? That is the sad part.
Right. So I think very right, because there is so much of a less access and resources are made available or are available for the patient. It doesn't even strike the patient, and many times not even to the doctors who are treating those patients, because the time is so limited, and then the patient is left to deal on its own.
Yes.
In their own isolation, in their own heads. They can't bounce back. They don't have a soundboard, and even though the ones they have, they are not equipped to handle that kind of information a lot of times. So that shut them off even more sometimes. Because we have stories like yours, very few, because we feel that most of the people go in the negative cycle loop. You start challenging yourself, and you've come to such an amazing level of, the way you have physically you have achieved, and another achievement. But very few we hear these kinds of things. Most of the people go the reverse thing. And as you said, not everybody has to do that. Not everybody has to go through that.
Exactly.
It's just how you start expecting certain things out of your own self.
Yes.
Right. So yeah, Vijay, would you like to add up to this part? Because what Kamal has just said, that how things become psychological. It's as much as physical, and that's what you told about cancer as well. That how stress has such a major role to impact the immune system and all of that. So can you please tell us more on that?
Sure. So I echo everything that Kamal has said about kidney disease with regard to cancer. If kidney disease is seen as dukan band, then cancer is very much seen as a death sentence, unfortunately, in our society, right? And so the approach that we take based on our experience is really to ask the question that when the doctors are treating the disease, who is healing the person?
Yeah.
And what tends to happen, at least in the space of cancer and maybe with many other illnesses, is that most people like us are able to get medical treatment, but we don't have access to the human side of it. So our focus is really to say, look, the doctors are doing the best they can, given all the constraints and given all the challenges. But what we want to do is to make sure that your mental, emotional, relational, and spiritual, we look at all these 4 areas. In fact, I personally don't like to club everything under mental health, because mental health is one side of it. I mean, our yoga tells us Pancha Mahakosha. There is the body, there is the breath, there is the emotions, there is the mind, and then there is the spiritual side of it. So I really believe that this is very important, particularly when somebody is facing cancer, when they are at their most vulnerable, when they are confronting death and their own mortality, that your state of mind is an important asset if you know how to use it and if you can learn how to use it. And what I want to say is that in our work, we come across what we call 3 different mindsets. Since we are talking about mental health today, let me talk about 3 different mindsets. The first mindset is that of a victim. This is that negative loop that Kamal just talked about. Life has attacked me, and I'm going to go into that negative spiral. I will never be normal again. The second mindset is what we describe as the mindset of a survivor. This is a mindset which says something bad has happened to me, a serious illness, I'm going to fight it. And I'm going to beat it. I'm going to overcome it. And this is, if you like, the kind of narrative that is currently being promoted in dealing with issues like cancer. But we believe there is a mindset which goes even beyond that, which is called the mindset of a thriver. And I can see in Kamal's eyes and his energy and his work that he has reached that point of being a thriver, where his illness and his adversity has become a stimulus for his growth and development as an individual and as a professional. And so the real issue for me is not just about helping victims become survivors. It's actually helping victims become survivors, become thrivers. And if we have to do that, we have to take responsibility for our own well-being with help of many other people. And that's the reason why you asked me the question earlier, why is the title of my book, My Cancer is Me? The reason why that is the title is because unless I can come to realize that my cancer is a disease of my own cells, I can never really empower myself to take charge of my healing with the help of the ecosystem around me. So my cancer is me, and my healing is also me. And that mental shift and that internal shift of perspective and of mindset, I believe, is what is required to change the narrative about serious illnesses like cancer. Because the social narrative and the cultural narrative has a huge impact on an individual's mindset. And so not only must the individual mindset change to become more of a thriver mindset, and there is plenty of research. So what I'm talking about is not just my view or a hypothesis. There's plenty of research now around this. In the same way, the social and cultural narrative and mindset also needs to change. And together we have a collective responsibility for doing that. So we like to say in our work, and I say about myself, that cancer healed me. So we like to say to our clients, let cancer heal you. Can cancer make you a better person? Can cancer make you a stronger person? Can cancer make you a thriver? So that you lead the rest of your life, whatever time you have left, you lead it in a certain positive way.
Wow. I guess, this whole thing of not just a survivor, but a thriver. I think this should be the new tagline for, that should be the tagline, right? So I guess that's quite inspiring, Vijay. So Dr. Singh, tell me about how often do you come across patients with these conditions for pain management, and how do you see the psychology there, and how do you manage it?
I think on daily basis, we are coming across with the patient who are suffering from pain because of any reason. They are coming with pain. Some person is having a spinal issues, arthritic condition, and certain patients are having no issues, but they are in pain, which is the difficult task to treat, because they are suffering from pain because of no pathology, no medical pathology, but they are the victim of pain. From 10 years, 20 years, 30 years, they're just coming from one doctor to another to another, because never ever their root cause is treated. because root causes is not because of the pathology. Root causes where they are arriving from. Their acute pain was not treated well, and they come across with the things we are developing in the face of chronic pain. That psychosomatic feature is very, very important to be treated.
Right.
Where we need a teamwork. And sorry to say, in India, we don't work in a team. We don't want to work in a team because we don't want to share our patient with others. This is somewhere, somehow, is the bad scenario of the medical professional in India. Nowadays,
Yes.
things are changing, and I hope it will be improved. But somewhere, somehow, if we share our thoughts with others, professional, and we share our patient with other professionals for their betterment, surely we will get the best result. Once
Are you,
their psychological
sorry,
factor, sorry,
no, no, sorry, I
once their
interrupted.
psychological factor, once their psychological factor is treated well in the initial phase, they never ever become a victim of pain. They never ever become a victim of chronic pain. I'm not talking of the patient who are suffering from pathology related to the pain, like arthritic conditions, severe spinal issues, or certain patients who are surviving from cancer and after that they are developing a pain.
Mhm.
But when they are treated well with their psychological factors, even after that conditions, they do very well with the drugs also. Because responding well with their condition needs a comprehensive approach from all the aspects, from their mental aspects, from their treating the root cause, and somewhere somehow treating their physical abilities also. If we are able to manage that part, surely we get the best result. And that thing required a comprehensive approach from all the professionals. And if we come as a team for pain management, especially, definitely patient will not become a victim of pain and they treat very well. There's so many research where we find out the thing. No medication is given to the patient, just placebo impact is given in the form of tablets. Especially when we were in Australia, we are doing that kind of thing. And patient is equally good. They are having the same kind of scenario. Even after taking the painkillers or even after not taking the painkillers, they respond the same. So that indicates somewhere, somehow their psychological impact is like this. Moving from one doctor to another to third one, and entering into the phase of drugs which are not good for him. And ultimately he become a kidney patient, he become a liver patient, and other problems are arising. So somewhere, somehow, psychosomatic factors should be treated well. And if it is treated by experts in the field and combined approach, I think we can rid of this problem in a better way. In our setup, we always try to do that kind of thing. We try to make up this scenario where patients get combined approach and they will develop the thing in a better way. But somewhere, somehow, it is needed. It is very much required, especially for the chronic pain patient. We're just
So,
focusing on factor, so then
right.
it will not be treated well.
So, Dr. Singh, tell me now, I mean, what kind of responses do you get when you tell the patient that they should seek a mental health expert?
It's really difficult. This is the
आप बोल
first thing
पाते
which is
हैं?
very, very difficult.
बोल
No,
पाते
it is
हैं?
very difficult. If you say
हाँ.
this thing to the patient, you need to go for a psychiatrist or you need to go for a psychologist. अब मेरे को कोई बीमार थोड़ी ना हो. I'm not a mentally ill. मैं कोई पागल थोड़ी ना हूँ. This is the first question arise from the patient. But somewhere or somehow, if family and patient understand that part, they will be treated well. Because sometimes treating the root cause of their mental behavior is very, very important. They feel
So what
very
I'm
good.
right. So what I'm trying to understand, are you able to convince any of the patients, or is it too challenging a task? किसी भी तरीके से, let's say we might have.
Definitely, it is very challenging for us to send them to the other professional related to the mental health. But somewhere, somehow, those patients who come across with this thing and they understand that part, they always treated well. तो हमारी कोशिश तो ये होती है कि we should treat them in a better way. We convey this message to the family also कि he need a combined approach. If we go with both the factors, he will treat it well. Certain patients understand it well. Sometimes it is difficult to make them understand. Those who don't understand, they just move from one doctor to another. कि भाई उस डॉक्टर के पास गया था, उसने तो मुझे पागल कह दिया है, तो मैं उसके पास तो जाऊंगा नहीं. So ultimately that scenario is there, and everybody is doctor in our world. Whosoever is going with the thing, chemist is giving their own medication, Babaji is giving their own things, and other people are giving all things. And end of the day, he developed with a thing which is not good for him. Because he is not having any pathology. And if you say this to the patient, कि you are not having any problem, उसको लगता है कि सामने डॉक्टर जो बैठा उसको कुछ नहीं आता. Because he is
that
not
is
able to
very
understand
heartbreaking.
that problem.
That's very
Yeah, this is
heartbreaking.
hard because ultimately you need to understand that part. Is saying you are not having anything is also a very tough task.
That's exactly. So, Dr. Piyush, okay, I would want you to respond to the same thing. How difficult is it for you to tell the patients to go for counseling or an evaluation? Dr. Vinay, you will have to respond to that later. How will you convince them? Huh.
So, see, when a basically cancer patient comes to me, the first thing when I basically break the news to these patients is we see as the carpet has been pulled basically from below them. So they are in a free fall. So first and the foremost thing is if you basically at that point of time, you don't pull their hands, pull them out of that deep gutter and basically do the initial counseling yourself, they will never listen to your basically advising a counseling for them later on. So how I convince is when my patient is basically admitted, if a patient basically gives me an indication that they want a counseling, fine, my job is half done. But when a patient is not ready for that, not basically willing to basically undergo that kind of counseling, because see in India we have a very big resistance towards mental health issues because हम सबको ये लगता है कि we are very mentally very strong and we don't need any counseling from anybody. So what happens is once I admit the patient, once we operate the patient, we feel patient is not basically able to cope up. Then we give our reference. We basically I ask the attendants basically not directly the patient because once you basically deal with the patient directly in terms of mental health, there will be a big resistance. So I basically talk to the relatives and usually the relatives agree because they can see what is happening there. So my way is an indirect approach, not the direct approach, because direct approach do not work with Indian patients. We are a bit basically on the lacking side in terms of counseling. The second thing is basically what initial counseling consists of is, see, there are two things that happen at the same time when we basically break the news. One is the patient stops living. It's not the death sentence that you have given to the patient in terms of basically disease biology. What really happens is patient, they basically declare it themselves as a death sentence and they stop living. And it's not the patient only who stops living. It is the attendants and the relatives, they stop. Because that fear of something that will happen 2 years from now is not going to let them live for another 2 years. Not the attendants, because they see a dead person in front of them. And the patient, when he looks into basically mirror, he sees himself as being done and over with. So my initial counseling basically tells them that, okay, boss, this is the diagnosis, not a death sentence. And if you basically keep me in a ring, I am not going to go down without throwing a punch. So let me offer this thing to you. So please, let's fight together and let's throw a punch, because that is the most important thing. Once you teach your patient to throw a punch, trust me, I don't know whether disease biology is going to basically make him survive for a year longer or not, but whatever time he is going to basically be there, as Vijay has told, he'll thrive, not survive. And that is what basically my job is.
Absolutely. I think that's very wonderfully put, I guess. So yes, I think that punch is important from every side, from the doctor, from the caregiver, from the patient. I think everybody has to do it together. Wo timings bhi same hone chahiye more or less. Otherwise, then we can, have the synergy going on at that point of time. So Dr. Vinay, now you tell us that when do you think is a time when, these patients should seek psychiatric help, and how can we manage these challenges? Dr. Singh had talked about that. Communicating with the patient to seek help is really tough.
Yes, ma'am. देखिए, other than the panelists जो viewers हमारे साथ जुड़ चुके हैं on the social media, for this link, I just मैं आपको briefly बता देता हूँ कि we are talking about the mental health in the patient with a long-term care. So basically, long-term care is involved in is called as a complex health care range, which include the medical, which include the personal and the assistance services for a patient which having a kind of physical problems or the psychiatric problems. It can, like if we talk about the physical problems, so it can be any chronic medical problems like you can say kidney problems, a cancer patient, or a patient from who is recovering from the stroke, or a patient who is recovering from a cardiac arrest, or a patient, if we talk about the psychiatric disease, so patients of Alzheimer dementia, a patient of Parkinson disorders, So such kind of patients, they require the long-term care. In the Western countries, there are special nursing home or the, you can say, personal care homes. But in India, we don't have much services for such kind of patients. So generally, most of the patients get either treatment at the hospitals or either they get the treatment at the homes. So as other panelists has discussed, and they had come out, both in such kind of patients, the both physical health and mental health both affect each other's. Like if conditions, the patient having a physical problem, so it definitely affect his mental health, and a person having the mental health issues, it's affect the physical health. So physical health and the mental health both, you can say, our body and the mind both are the work in the unison. They are not in the separate entity. So we have to definitely take care of the both the things when we talk about the long term care of a patient with such kind of conditions. Second things, जैसे कि हम बात करते हैं कि बहुत से हमारे एक्सपर्ट्स ने हमें बताया कि nowadays more and more focus on the quality, improving the quality of life. अगर हम बात करते हैं जितने भी साइकेट्रिक प्रॉब्लम्स हैं, तो क्या होता है कि साइकेट्रिक, बहुत से हमारे पेशेंट्स आते हैं, वो बोलते हैं कि सर साइकेट्रिक दवाइयाँ कब तक चलेंगी, ये कभी बंद ही नहीं होती हैं, और कभी इलाज तो कभी मतलब खत्म ही नहीं होगा, बीमारी तो कभी जड़ से खत्म ही नहीं होगी। तो हम उनको यही समझाते हैं कि बेसिकली द मेडिसिन, ठीक है, वी कैन अंडरस्टैंड कि मेडिसिन लंबे समय तक चलती है, बट दे इम्प्रूव द क्वालिटी ऑफ लाइफ। अगर आप मेडिसिन नहीं लेंगे, दवाइयाँ नहीं लेंगे, तो आपकी जो क्वालिटी ऑफ लाइफ कैसी रहेगी, और विद मेडिसिन आपकी क्वालिटी ऑफ लाइफ कैसी रहेगी, उसमें काफी फर्क रहेगा। तो इस वजह से उनको कन्विंस किया जाता है कि व्हाई द मेंटल, यू कैन से, मेंटल हेल्थ के लिए जो दवाइयां हैं या जो ट्रीटमेंट है वो क्यों जरूरी है। जहां तक लॉन्ग टर्म केयर की बात है, मैं अभी सिविल हॉस्पिटल में काम कर रहा हूँ, तो अभी आई डिडंट कम अक्रॉस सच काइंड ऑफ पेशेंट, बट व्हेन आई वाज डूरिंग माय पोस्ट ग्रेजुएशन एंड माय सीनियर रेजिडेंसी ड्यूरिंग द एम्स टाइम्स, so we used to got the calls from the different डिपार्टमेंट टू अटेंड द सच पेशेंट्स। तो ज्यादातर इस तरह के पेशेंट्स में जो सबसे हमारे पास सबसे कॉमन इश्यूज आते थे, वो आते थे डिलीरियम। डिलीरियम के मतलब कि द काइंड ऑफ कंफ्यूजनल स्टेट, जब पेशेंट मतलब कि सिर्फ चार दीवारी में कन्फाउंड होकर रह जाता है, या फिर वो बिस्तर मोस्ट ऑफ टाइम वो बेड रिडन रहता है। इसके अलावा जो सबसे कॉमन कंडीशन जो पाई जाती हैं इन तरह के पेशेंट्स में, दैट इज द डिप्रेशन के अलावा डिप्रेशन, और उसके अलावा मेमोरी प्रॉब्लम्स। वी कैन से द डिमेंशिया इज क्वाइट कॉमन इन सच काइंड ऑफ पेशेंट्स। इसके अलावा इफ वी फाउंड कि देयर सच काइंड ऑफ, इफ द पेशेंट हैविंग द स्लीप एंड एपेटाइट डिस्टर्बेंस, और इफ दे हैविंग आइसोलेटेड और विथड्रॉन बिहेवियर, तो सच काइंड ऑफ पेशेंट्स में मेंटल हेल्थ जो है सर्विसेज को हमें आई थिंक उनकी हेल्प हमें लेनी चाहिए। तो जैसे मैंने बताया कि डिलीरियम के केसेस के अंदर जनरली पेशेंट्स या फैमिली मेंबर्स को ये बताते थे कि जितना भी ज्यादा कोशिश होगा पेशेंट को आप अवेयर कराना है सराउंडिंग्स के बारे में, आज क्या तारीख है या अभी क्या समय हो रहा है। हम उन्हें ये भी कहा जाता है कि अगर पेशेंट अगर चल फिर नहीं पाता, तो उन्हें व्हील चेयर पे ही आप चाहे उनको एक बार बाहर तक आप उनको थोड़ा सा घुमा फिरा लाइए, ताकि थोड़ा सा उनको टाइमिंग का और उस सब जगह ओरिएंटेशन बने। दूसरा, फ्रीक्वेंट विजिट बाय द फैमिली मेंबर्स अगर उन्हें फ्रीक्वेंटली विजिट करते हैं और उनसे बात करते हैं, तो उससे भी उनकी इस तरह की कंडीशंस में काफी सुधार देखने को मिलता है। यस, अगर कुछ प्रॉब्लम्स सिर्फ और सिर्फ इन सब चीजों के, जो हमारे आसपास का एटमॉस्फेयर है, उस सब चीजों से अगर करने से इंप्रूवमेंट नहीं हो रहा है, तब फिर हम मेडिकेशन की जरूरत होती है। जैसे कि डिप्रेशन है, तो डिप्रेशन उस क्रॉनिक मेडिकल कंडीशन की वजह से भी हो सकता है, और वो एक एज अ पार्ट ऑफ एडजस्टमेंट प्रॉब्लम, बिकॉज ऑफ जो प्रॉब्लम हो गई है उसकी वजह से भी हो सकता है। तो वो एक प्रोफेशनल के द्वारा वो आइडेंटिफाई किया जाता है कि हाँ भी ये जो इस तरह के प्रॉब्लम्स में हमें मेडिकेशन रिक्वायर है या नहीं है। इस तरह के पेशेंट्स में कई बार थोड़ा सा साइकोटिक सिम्टम्स भी आ जाते हैं, जैसे कि पेशेंट्स को कई बार अनयूजुअल परसेप्शंस, हेलुसिनेशंस वगैरह होते हैं, या उनको कुछ डिल्यूजन्स वगैरह डेवलप हो जाते हैं। तो वो भी एक मेंटल जो एक्सपर्ट होता है, मेंटल हेल्थ एक्सपर्ट, उसके द्वारा वो आइडेंटिफाई करके उनके ऊपर आई थिंक वो ट्रीटमेंट स्टार्ट किया जाता है। तो इन सब चीजों को बहुत डिटेल में मुझे लगता है कि जांच करने की जरूरत है। और So I think that's from my side for
Right.
the current question, ma'am.
Right, right. Thank you, Dr. Vinay. So, Dr. Vinay, tell me something. Like in the government hospital, तो यहाँ पे भी आपके वहाँ पे patients आते हैं dialysis के और cancer के और other life-threatening conditions admission होते हैं इन लोगों के?
मैम हमारे पास ज्यादा जो पेशेंट्स आते हैं वो जो मैक्सिमम हमारे यहाँ पर जो एवरेज ड्यूरेशन ऑफ स्टे है इज 2 or 3 days. So we
Okay.
don't have the facility to keep the patient for the longer time.
Right,
जनरली
right.
जिन पेशेंट्स को लॉन्ग टर्म केयर की जरूरत होती है हम उन्हें आगे उन्हें रेफर कर देते हैं.
Okay.
We at our own level अभी हम डिस्ट्रिक्ट लेवल पे सिर्फ एक्यूट कंडीशंस को ही मैनेज कर पाते हैं.
Right, right. So yes, so coming back to the big question that how do we integrate? Because anytime we have to ask the patient to go and see somebody, that's not happening. It's very difficult. But जैसे हमारे हॉस्पिटल सेटअप में सब कुछ इंटीग्रेटेड रहता है, डाइटिशियन आके अगर चेक करती है तो सब जवाब मिल जाएगा, सारे फीडबैक लूप अपने आप चलता जाएगा. पर अगर आप पेशेंट को बोले कि आप डाइटिशियन को मिल लो तो पेशेंट नहीं जाएगा.
Right.
Similarly, I think we will have to create a system where, again, integration happens from that particular level.
Exactly.
Otherwise, hamesha we will end up escalating the situation, and only when there's a crisis, the experts will be called for. If there is a facility and there's access to that part of it. You want to add something, Vijay? Sure. Can you unmute yourself? Yeah.
Yeah.
Yeah,
I wanted to say that to my mind, it really starts with a basic awareness and education. That, for example, the commonly held notion of health, the association is with arogya, which is the absence of disease. Whereas we all know that true health is not just arogya. True health is actually swasthya. It's a state of well-being where you are deeply established in yourself and you're willing to understand yourself at every level and take care of yourself at every level. And this is not a concept only for the highly educated. Even in our traditional systems, there is a difference between arogya and swasthya. Arogya requires urgent attention because some health issue has happened. But swasthya requires continuous and consistent attention.
All right.
As a way to actually potentially even prevent certain conditions from taking place. As most of the panelists have said, being able to identify and understand the root issues and deal with them. If we had this basic understanding that when I look at health and when I get help from somebody else, it is not only because I have a problem that my health has suffered, but it's because I am truly interested in living a high quality life. Somebody said a quality of life, that I'm really interested in living a high quality of life. And the good news is that because of modern media and all of that, this is increasing. So I'll give you a small example that in our work with the corporate sector, where we don't talk about cancer, but we talk about stress and well-being and burnout. Young people are immediately able to see that, hey, what I'm facing in my day-to-day work needs to be addressed as if it were an illness. Not to wait until I get the illness, but I have to address it now and I need good help, and people are therefore willing to go out and seek help and get help. So for me, if we start to deal with it only when somebody reaches the clinic or somebody reaches the hospital or somebody is rushed to surgery, then actually we have lost the plot. The plot needed to have been addressed much earlier. And so actually my question to the panelists is, how can we bring this integrated thinking much earlier in the process, rather than wait for it to reach a place where we are trying to deal with the actual issue that has already occurred.
Yeah, I guess that's quite a food for thought. But as coming to the topic, we are talking about when we actually have an issue at hand, right now when we're talking about it. So I guess yeah, so we will have a complete discussion on that, because that makes a lot of sense, even in terms of both mental well-being and physical well-being. That's what you're saying, that it's not just absence of a disorder or a disease, but how fulfilling the life in itself, it's, before that part of it. Actually, that's very important. Right. So, all right. So, Kamal, I want to come back to you with, something very interesting. You mentioned the role of meditation, and you started with your 10 minutes and you started doing it like twice a day, and you kind of increase it to 40 minutes. I was kind of maybe ignorant to some extent at how much these things can play a role, when we are in a situation like this. So could you please tell us, and maybe we could start early. You still maybe ventured out in this little later part of your life, I guess. I'm sure you would like to recommend it to your, to other people.
I recommend it to everybody I meet, in fact, nowadays. So, in fact, just to respond to Vijay's comment on the looking at it, how to prevent and so on, I think when somebody gets diagnosed with a long-term kidney or long-term any chronic condition, right, whether it's cancer or kidney disease or liver disease and so on, doctors make it a point to tell them how to prevent certain other conditions that can come along with your current ailment, right? There are several other things. For kidney disease, there are things like neuro, and there is liver could be affected. Cardiac, of course, is the biggest problem. So doctors give the patients tips on how to prevent getting those conditions. However, again, the lack of awareness on mental health and so on do not kind of goad them into giving tips on how to prevent even mental health problems along with the kidney health problems, right? Along with, like, for example, when they tell them about the heart or the liver and so on, they should also look at it in terms of mental health, right? Tell them to look for signs, tell them to look for how they can actually prevent going into mental health conditions to start with. And of course, the thing around treating it when it comes, that holds. But I'm saying even in terms of prevention, that is a thing to be considered. Now, coming back to your thing on meditation. So honestly, I started meditation only like about 5 years or so ago, but I've been just so blown away by the benefits within a few months of just doing like a 10-minute routine in the morning. And this is a secular meditation. It is not related to any religion or any belief system. It is just simply awareness of your breath, and it kind of gives you so much. I mean, you can actually see the benefits of not only being able to deal with things like stress and so on, but it's important to be able to observe your mind, how, like, for example, just to give an analogy, right? Let's say your wrist is paining, somebody's wrist is paining. They are able to observe and notice that the wrist is paining. However, all of us human beings, due to how we are made and how evolution has happened, we kind of tend to identify with the minds, right? Whatever the mind is thinking, we tend to identify with it. We don't look at it as the mind as another organ which has its own activity, which happens to be thinking, right? And we don't know how to observe what the mind is doing. So how that is useful is, let's say, on long-term kidney disease or dialysis or liver disease or any chronic condition, when people start getting depressed, when people start thinking, my life is done, I'm dead, I'm going to die, what is this life? That thought pattern, meditation teaches you to become aware of these thought patterns when they arise. So in meditation, honestly, the benefits of meditation go much beyond the cushion. And beyond the cushion means when you're actually meditating, it's called being in the cushion in meditation jargon. But basically, meditation has benefits far beyond the cushion. Like it has a lot of benefits apart from that 10 minutes or 1 hour or 2 minutes of meditation time that you're doing. The real benefits of meditation actually are when you're not actually meditating, because it trains you to observe these negative patterns and then immediately say, okay, I'm going down that path, I need to step back. It teaches you to identify from that. It's like really amazing. And research, these are all the benefits of meditation today are backed by randomized controlled trials in an extremely scientific manner. There are dozens and dozens of articles in very, very reputed. It's not something that is relegated to the psychics anymore. It is part of mainstream science today. There are a bunch of articles in some of the best journals today. There is hard evidence on the benefits of meditation.
Absolutely. I guess that would be one of the takeaways for us from today's talk, that, meditation can actually go beyond just mental, that thing. It also helps you with your physical condition immensely. And it's for all. I guess that's more important. It's for all to take that part. Right.
Yeah, like I just want to add on certain things.
Yes.
I think to get out of this thing related to any mental issue, it is very important to focus on a child health. If we are focusing on a child mental health from the initial phase of life, they will not develop a behavior which is related to the small things giving them a stress. If you treat that at the right level when they are occurring in the childhood, you are
Mhm.
able to treat a person for his whole life. So it is very,
Absolutely.
very important to integrate that part properly in a schooling level.
From
When you are
absolutely.
able to judge your stress level, anxiety level in an initial phase of life, and when it club in and in later phase of life, small things give you anxious behavior, and that develop a disturbances in your mental behavior. So we have to
Absolutely.
work together from the roots, and that roots should be worked together whenever we are working on the childhood behavior. So it's very important that we should club in and work together for the mental health, physical health, and other health issues together. But from patient's point of view, it is really difficult for them to go ahead with the financial aspect for that. If you are clubbing all the things, it is giving us a lot of burden to the patient. So our
Right.
insurance company, our government, our NGOs, or other platforms should come together and work in the good behavior, and they will work together to develop these kind of platforms. And somewhere,
Right.
somehow, all professionals need to somewhere have to understand that thing. If it is not their cup of tea, they should go ahead with the thing ahead and transfer that patient to the right approach and right person. It will give them a better results, I think.
Outcome. Absolutely. I think that's a very good emphasis on the cause. As you're talking, either we're talking about preventive, when you talk about children, that we kind of build up how they can manage certain situations, stressful situations from the beginning.
If anything happened negative in the childhood of a child, you always find that that behavior lasts for rest of his life.
Right.
That
The
small
trauma.
things always give impact in their life, and if we are not treating that behavior at the right time, it is developing a chronic issue for that patient. Simple
Absolutely.
backache, I'm not talking about the other chronic things. Simple backache, if they start reading about it on the net, it lead to paralysis, it lead to this, and it lead to that, and they develop that behavior, and
Mm.
10 years, 20 years, that patient is suffering from a no cause back pain. No cause back pain. No pathology is there, but they're suffering from the pain. Every
Mm.
alternate days or other days, they're going to one doctor or another or treating their patient, but
Mm.
not getting rid of the pain.
Right.
It is important to change the behavior at the right time. And I think it's initial issues which parents should understand when and where they have to take the expert's opinion. That is very,
Right.
very important.
Yeah. Coming back to you, Dr. Piyush, could you please emphasize and tell us that how the primary treating physician, because most of the times our patients, they land up with the primary physician. Okay, how they can counsel, especially conditions like cancer. Could you unmute yourself, Dr. Piyush?
Yeah. So as I earlier said, the same thing I'll be basically repeating with a few.
Okay. Yeah.
That when the patient comes to me or any other physician who is going to treat basically chronic disease, the most important part to understand that patient is not going to go easily to a mental health counselor. So it is their responsibility as such, the primary physician, because the problem in India as such, which I see every day, is that we don't counsel, we don't care even about basically a mental health issue. हमको patient आया cancer है, we diagnose, we start treating, we forget that they are human beings and they deal with basically a lot of basically survival issues, as well as there are cost issues. So many things are going in their life. So suddenly you have a massive cost issue, you have survival issue. There are no guarantees with that disease. You even don't know whether basically the complete treatment and the pain you are going to go through, whether you are going to survive or not. For a mother, what really entails is once she is diagnosed, she's so worried about her kids, their future. And a male thinks in a very different way. They start thinking about what will happen to my family if basically I lose the battle. So now if as a primary physician, you are aware of how basically a human brain basically thinks in a stressful situation, then you will be able to cope up with those issues yourself, as well as you will be able to help patient cope up with those issues. So when I joined my MCH in surgical oncology in 2012, from 2012, my first year, I started observing these patterns. I used to talk to a lot of my patient and attendants. And from there, I decided, okay, boss, there are a lot of issues which need to be tackled. Disease is one part. The treatment is an automatic form of management. So basically, patient will have to undergo surgery if the surgery treatment or to undergo chemotherapy. That is going to happen. Nobody is going to stop that. The biggest problem is the second aspect, which we forget to basically even address. So once they come to you, you start on the treatment. You take care of your own part. Okay, boss, this is my part. I have to. So sorry, boss, this is not your part. You have to look towards a patient as a complete human being with so many attachments, be it the attachment to the kid, be it the attachment to the parents. सिर्फ ये उनके अपने attachment नहीं है, दूसरों के भी उनसे attachment है. So once you recognize those attachments as a physician, and I feel the biggest drawback in the medical education in India is that physicians are not basically being taught to be human. They are taught to be physicians first. So I think if we basically physicians are being taught to be humans, think like humans, and then be physician, then they will be able to address the issues better, because they will be able to address the basically finer points, the things that matter. Disease actually, okay, fine. Other person is also intelligent enough to understand, okay, I have a disease, I have to undergo treatment. But this is not what matters. What matters is the things that are basically attached to it. Their emotions, their financial issues. There are so many things. Future, the thought process of future. I have talked to mothers. Trust me, they are not worried about them dying. They are not worried about the disease getting treated or not. What she worries about, the first thing is her kid. So if you basically counsel her about that, if you basically make them mentally prepared that, okay, this is the thing, this is going to happen, this may happen this way, they start preparing themselves and they start living their life. If you tell them, okay, boss, fine, disease is one part. You spend good quality time with your kids. That matters, because the moment she is diagnosed of a disease, that time with the kid, the quality time with the kid and the parents, that goes up. And that is what we are here for. None of us is assured of 100 years of lifetime. What we basically every day live is the life. So you don't stop living your life, even if there is only 1 month left. And the problem with the chronic is that people stop living. They start dying the moment you basically diagnose it. And the physicians, they are not capable enough. They are not being trained well enough to basically identify and treat it at the point, at the source.
Absolutely. So I think a very valid point here, Dr. Piyush, that one that, because, well, I wouldn't say that human and not human, but I'll definitely say that maybe the physician, the approach is very different when you're treating a patient for that matter. And a lot of time what happens is we are not even able to ask कि आपका मन कैसा रहता है, आपकी नींद आती है कि नहीं आती, ये parameters हमारे नहीं होते. And we miss a lot over there. And sometimes even the patient doesn't know कि वो किस platform पे ये बात कर सकता है या कह सकता है. He always thinks there are bigger things to be taken care of, you know, kidney and and other things for that matter. And the doctor also feel that मेरे पास इतना time नहीं है कि मैं ये सब बात कर सकूं. And then पेशेंट के पास कोई और जगह नहीं है जहाँ पे बात कर सके. जो लोअर स्टाफ है उनसे उन्हें पता ही नहीं है कि ये डिप्रेशन हो सकता है या ये एंजाइटी हो सकती है, बिकॉज दे फील कि ये तो उसको अपने आप ही डील करना ही है. It's taken for granted. Nobody talks on ventures in that direction at all. I was talking to one of the urologists and he said कि ये तो हमारे नर्सेस देखते हैं और स्टाफ देखते हैं और नर्स को बुलाया ये बताएंगी, अच्छा बताओ डिप्रेशन क्या होता है. She was totally blank. I don't know. So it's so important to sensitize everyone who's in contact, because of course it would be very unfair if we expect everything from one doctor to do everything all the time. But yes, there should be some sensitizing part there happen, and there has to be infrastructure which needs to, complement the current system right now. Integrate with that particular system. So I guess that is really, really important, that if we can bring both the things together here.
So what you are saying is basically, see, what I can understand, I have always wanted in a system basically which treats the chronic patient is the first point of source, first point of contact should initiate, and then basically people should complement it. So what is the problem is the initiation is not there. So any reinforcement doesn't work. So first is basically the physician should be well trained, initiate the talk, and then there should be reinforcement from the supportive staff, and that what really matters.
Right. Kamal, you have any suggestions for this? How can we get it into the system? How will that work out?
I think honestly, Dr. Singh, I think in our case, protocols and education about those protocols is very important, because in honestly the field in India is like a jungle, right? Like there are like so many patients and so many doctors. Unless you protocolize it and publicize those protocols and let everybody know that
Yes.
here is, you know, a set of protocols that you can use, because how many doctors would actually have the time to research on, you know, how to deal with these things? So if, let's say, a body of mental health practitioners or experts in this field can publish a set of protocols, these things will take time. Of course, it cannot be developed overnight, but let's say in consultation with the specific conditions like kidney or cancer and liver and so on,
Okay.
heart and so on, together a team can sit and formulate a set of protocols which can be reviewed every few years, and these protocols can be handed over, because honestly very few physicians would have actually access to these kind of papers and journals and be able to do their own research and formulate the way to handle these things. But if a set of, most diseases today have various guidelines for how to deal with these basic things, but I am pretty sure there is very little or nothing in
Yes.
mental health. So if that can be added to the, you know, to the weaponry, that the battle gear that doctors can use when they're treating patients, and make mental health a part, it should be a standard part of care. It should not be something
Yes.
needs to be, you know, thought about too much. Of course, attention needs to be given, but if these set of protocols is there and publicized well enough, I think that will be a huge improvement, a huge
Yes.
help to nephrologists and cancer oncologists and various specialties in adding this, you know, to the
Right. Yeah, I guess that's a pretty relevant and a very important point you made. And I guess we are trying to do that in some way at Listen also. Just hope we can make that breakthrough here. So I guess, I think, Kamal, you have to leave at 6. So I think we will have to let you go. So we'll have you again soon. And thank you so much for being here. And
I'm very
it's-
happy to be here, and I'm so glad I could be a part of this panel. And thank you to all the panelists, and thanks to Dr. Singh and Krishnaveer.
Thank you so much. Wish you well. See you soon again. Bye.
Yeah, sorry. Actually, I also have to leave. Actually, my patients are waiting for the OPD.
Oh, so you want to, okay, fine. Okay, fine. I won't hold you back either,
Really
Dr. Singh. Thank you so much for joining us. It was a pleasure having you here. Thank you so much.
Thank
Yeah.
you. Thank you. Thank you.
Okay.
Okay.
Bye.
Take care.
Yeah, Vijay, I want you to add up in terms of how do we, bridge this gap? What can be done?
Yeah. So I think some really good suggestions have already come up from Piyush and from Kamal, etc. And since the topic of this conversation is mental health in long-term care, right? Now, when I look at long-term care, particularly when it comes to cancer, right? Long-term care is really relevant in the space of cancer. And what I think sometimes we miss is that long-term care needs to occur outside the hospital as well. In fact, let us say, and Piyush, I know, will back me on this. Let us say that somebody has been through surgery. Let's say I went through surgery for colon cancer. Okay. And then after my surgery was done, I was home. I didn't have contact with the doctors anymore. And I had to deal with all these mental, emotional, psychological, spiritual challenges without having access to the doctor because I was not in hospital. So when we think about long-term care and mental health, we have to think about the post-hospital situation. So far, we've been talking about the in-hospital situation.
Yeah.
But the in-hospital situation, in my view, is only 10% of the life that the person has to lead. And so there is no option but to, as Piyush and Kamal have said, of course, we have to create the protocols within the hospital or within the medical environment, but that only accounts for 10%. What about the other 90%? And in that other 90%, this is where the role of the caregiver, in my view, becomes absolutely critical. Because in a way, the caregiver becomes the quasi counselor for that other 90%.
Mhm.
So I can tell you from my personal experience that my wife Nilima has played that role, and I credit her with saving my life to the same extent that I credit my surgeon for saving my life.
Wow.
So I would say that a very, very important piece for us is to take the caregiving side of it very, very seriously.
Absolutely.
And we need to educate the caregiver what signs to look for. What are some of the simple day-to-day coping strategies? As Vinay said, or Piyush said, आप उनको wheelchair पे लेके बाहर थोड़ी हवा खिलाओ, right? Because that will change your mood. It will get some endorphins going.
Yeah.
Right? थोड़ा सा stretching करवाओ. You may not have access to a physiotherapist, but that little bit of stretching is going to change how your energy flows in your body. Your prana will start to move again. So my input here is that long-term care requires the post-hospital situation to be taken into account. And in a post-hospital situation, the caregiver can potentially be the pivot or the catalyst
Right.
to diagnose and say, no, I don't think this is something that can be dealt with at home. For this, we need to go see a doctor.
Right.
Without that, I think we are over relying on the hospital system or the medical system, which in any case accounts for only 10% of long-term care.
I would also like to add up a little there about as much as caregiver needs to be empowered and trained and educated, it's also important to keep a tab on the caregiver burden
Of
and
course,
caregiver stress. I think it's very important. As you said, a lot goes into it
of
from both the
course.
sides. And I guess that's really important that we are able to extend that kind of a ecosystem for the caregivers as well.
Yes.
Yeah, I'm sure.
Totally right. Totally right.
Yeah. Okay, Dr. Vinay, we have a question for you. How do we distinguish between a psychological pain and a biological pain? Okay. From the audience, so.
Ma'am, there are lots of patients in the OPD report because like they're consulted various places. उन्हें बहुत सी जगह उन्होंने डॉक्टर्स को दिखाया, बहुत से उन्होंने इन्वेस्टिगेशन कराए, और जब कुछ भी इन्वेस्टिगेशंस में वो निकल के नहीं आता है तो जनरली मतलब कि जो भी स्पेशलिटी के लोग हैं वो साइकेट्रिक में उनको रेफर कर देते हैं, उनको लगता है कि डेफिनेटली इट्स साइकोसोमेटिक ओनली। तो ऐसा जरूरी नहीं है। साइकोसोमेटिक जो हमारे जो एक मेंटर थे वो कहा करते थे, साइकोसोमेटिक इज नॉट द डायग्नोसिस बाय द एक्सक्लूजन। Psychosomatic is a proper psychiatric diagnosis and there should be some stressors associated with. तो इस तरह के जो भी पेशेंट्स हमारे पास आते हैं, हम उनको अच्छी तरीके से उनको इवेलुएट करते हैं, उनसे बात करते हैं, एंड हम देखते हैं कि जो स्ट्रेस है उनकी लाइफ में, उनको जो स्ट्रेस है और उनकी जो प्रॉब्लम्स हैं, जो साइकोसोमेटिक जो प्रॉब्लम्स है, उनके बीच में क्या कोरिलेशन है। तो डेफिनेटली मतलब कि उस चीज के में कोरिलेशन निकल के आता है और देन फिर हम मेडिसिन स्टार्ट करते हैं और फिर फॉलोअप पे जब उनको देखते हैं कि मेडिसिन के बाद उनको कुछ इंप्रूवमेंट दिख रहा है तो डेफिनेटली कहीं ना कहीं एक वो साइकोसोमेटिक कंपोनेंट उसमें होता है।
राइट। सो आई थिंक हाँ, मोस्टली हम यही देखते हैं कि उनके सारे टेस्ट में कोई प्रॉब्लम नहीं होती है।
yes.
और वो सालों साल फिजिशियंस और गैस्ट्रो और कहाँ न्यूरोलॉजिस्ट के पास जा रहे होते हैं, एंड द मोमेंट हम उनको एक साइकोलॉजिकल कॉन्टेक्स्ट देते हैं थ्रू मेडिकेशन एंड टूथ थेरेपी, देन वी स्टार्ट फाइंडिंग some changes there, and I guess they're able to link that ways कि हाँ ये कितना साइकोजेनिक है। तो साइकोजेनिक का मतलब ये नहीं है कि पेन नहीं हो रहा है, साइकोजेनिक का मतलब है कि
वो हमें शुरुआत से हमारी टीचिंग में ये सिखाया जाता है कि you first rule out the all possible medical factors,
right,
or all possible medical cause for the conditions. आप उसके बाद अब श्योर है कि मेडिकल कंडीशन की वजह से नहीं है, then you evaluate on the psychiatric perspective.
Right. So I guess with that we have come to end of the session, but we still feel कि incomplete है, इतना कुछ है बोलने के लिए, and Vijay, we would love to have, actually we'll love to have each one of you separately for a separate session altogether, and we can actually go on with it.
In 2 minutes, I just want to tell my concluding remark.
Sure.
तो जैसे कि मैम इन फाइनली मैं ये कहना चाहूंगा कि सबसे पहले तो डेफिनेटली जैसे कि बीच में सर थे, मैं उनका नाम भूल गया, जैसे उन्होंने बताया कि फ्रॉम द चाइल्डहुड ओनली। तो डेफिनेटली हमें अपने स्कूलों में, हमने अपने पाठ्यक्रम में इस तरह की चीजें हमें इन्वॉल्व करनी है भी, जो सिर्फ पर्टिकुलर सिलेबस के अलावा बच्चों के अंदर लाइफ सिचुएशन को कैसे डील करना है, स्ट्रेस सिचुएशन को कैसे डील करना है, इस तरह की चीजों को सिखाया जाए। हमारी लाइफ में हमारे टीचर्स जो है या स्कूलों में ये तो सिखाया जाता है कि आपको फर्स्ट कैसे आना है, लेकिन ये नहीं सिखाया जाता कि अगर आप फेल हो जाते हो तो आपको उससे कैसे डील करना है। तो आई थिंक वो सब चीजें
Yes.
भी एक करिकुलम का हिस्सा होना चाहिए। सेकंड थिंग, जहाँ तक जैसे मेडिकल ग्रेजुएशन से मेडिकल ट्रेनिंग की बात है, उस दौरान जो अदर स्पेशलिटी के जो डॉक्टर्स हैं, चाहे वो मेडिसिन हो, चाहे सर्जरी हो, चाहे गायनी, कोई भी हो, हमें कहीं ना कहीं उनको सेंसिटाइज करना होगा कि मेंटल हेल्थ इज नॉट ए सेपरेट थिंग्स। मतलब कि ऐसा नहीं है कि आपको कोई मेंटल हेल्थ इश्यूज लग रहा है तो आप उसको सीधा सिर्फ साइकेट्री के पास करते, आप अपने लेवल पे साइकेट कैचिंग अप द साइकेट्री, और उसमें एक सुपरफिशियल यू कैन से उसके अंदर इंटरवेंशन करना कोई टेक्निकल चीज नहीं है, बट लेकिन आपको उस चीज को लेकर थोड़ा सा एक सेंसिटिविटी होनी चाहिए, आप थोड़ा सा एम्पैथिक होने चाहिए। तो अगर इफ यू विल जस्ट टॉक, जब 5 to 10 मिनट्स आप सिर्फ उनसे प्यार से बात कर लेंगे, तो वो भी एक बहुत एक हेल्पफुल फैक्टर्स के तौर पे पेशेंट को हेल्प करता है।
Right.
तो ये सब चीजें जो बाकी मेडिकल ग्रेजुएट्स जो अदर स्पेशलिटी के हैं, वे उनको भी मतलब कि साइकेट्रिक एक सुपरफिशियल साइकेट्रिक एवेल्युएशन को करना आना चाहिए। दूसरा चीज, व्हाट आई से दैट इज यूनिवर्सल स्क्रीनिंग परफॉर्मा सच काइंड ऑफ को हमें अप्लाई करना है। जो भी जहाँ पर भी जिन पेशेंट्स को लॉन्ग टर्म केयर की जरूरत होती है, वहाँ पर हम एक यूनिवर्सल स्क्रीनिंग परफॉर्मा वो एक लागू हो, ताकि वहाँ पर कोई ऐसी चीज मिस आउट ना हो जाए जो कि मेंटल हेल्थ से रिलेटेड हो। ऑब्वियसली जो भी अलग अलग डिफरेंट सर्विसेज हैं लॉन्ग टर्म केयर को लेकर, वो पास पास हो तो डेफिनेटली वो पेशेंट को फायदा होगी, को लोकेशन होनी चाहिए उनकी। अगर वो दूर है तो इसमें इस कंडीशंस में जो कम्युनिटी नर्स हैं या साइकेट्रिक सोशल वर्कर या जो दूसरे सोशल वर्कर्स हैं, हम उन लोगों को स्ट्रेंथन करके उनकी हेल्प
Right.
लेके इन सब चीजों को इंटीग्रेट कर सकते हैं। एंड डेफिनेटली जो हमारा जो अप्रोच है दैट शुड बी पर्सन ओरिएंटेड, वो एक होलिस्टिक अप्रोच होनी चाहिए, और मोर एंड मोर अवेयरनेस ऑन दिस।
Right.
these are the challenges जो हमें आगे लेना चाहिए, and we have to work on this direction.
Right. I think that's a very good suggestion, जहाँ पे हम बात कर रहे हैं कि हमें अपने रिसोर्सेज को कैसे यूटिलाइज करना है, जिस भी लेवल पे है, because they are the ones which we have. We can't be keep aiming at the ideal one and the best one and the perfect one. उस केस में हमारे जो हैं वो हम यूज नहीं कर पाते, and I
Right.
think that would be a great help actually. और Dr. Piyush, any last comment, remark, suggestion?
It's always, as I basically tell my fellow consultants as well as the juniors also. So you have to start looking patient as a whole. You should not be treating the basically disease. You should be taking care of the disease, and these are very different terms. People think these are the same terms. So treating a disease and taking care of a disease is entirely different. And once we know that difference, if we can teach that difference to people who are primary basically care providers, I think a lot will change in this country. Plus, I think it should be basically made a protocol of basically in terms of basically dealing with chronic disease patients. That is basically, as you said, that dietitian and a physiotherapist is going to visit them regularly. Why not a counselor too? So I think hospital should basically start from there, because we cannot, as Vijay said, yes, it is a 10% part, but in cancer we have learned to see towards that 10%. So once you take care of that 10%,
Yes,
that's
absolutely.
coming. So first, if we start on that, automatically things will change. We have to start from scratch. Right now, that counseling is not available to the patient as a mandatory part. So I think that should be available to any chronic disease patient as a mandatory part.
Wow, yes.
Then we can take care of basically the other things, because as much as physiotherapy is required, I think more requirement is of basically psychological counseling. Half of the pains will go away, both mental and physical, both. So it's
Right.
The hospital should incorporate this thing.
Yeah. Great. Very great input.
Ma'am, one more thing from my side, like
yeah.
जैसे कि जो भी सेकंड वेव जो हमारी कोविड की आई थी, उससे भी बहुत से ऐसे लोगों से हमारी बात हुई कि जो भी पेशेंट चाहे वो कितना भी सीवियरली इल रहा हो, लेकिन जिसके पास साइकोलॉजिकल सपोर्ट अच्छा था, उनके अंदर रिकवरी देखने को बहुत अच्छी मिली।
Absolutely.
मैं
True,
आपको
true.
एक एग्जांपल देना चाहूंगा कि हमारे फ्रॉम माय टाउन देयर वाज अ वेरी गुड फिजिशियन हु वाज इन्वॉल्वड इन ट्रीटमेंट ऑफ द कोविड पेशेंट्स। सो व्हाट हैपेंस, उनका ट्रीटमेंट चल रहा था, लेकिन द फैमिली मेंबर थॉट कि हम इनको किसी अच्छे बड़े हॉस्पिटल में जहाँ पे इनके बेटर केयर पॉसिबल हो, हम उनको वहाँ शिफ्ट कर देते हैं, तो शायद उनका और अच्छा इलाज चलेगा। लेकिन वहाँ पे आई विल नॉट, मैं हॉस्पिटल का नाम नहीं लूंगा, लेकिन वहाँ पे जाने के बाद, क्योंकि वहाँ के आईसीयू इतने पैक होते हैं कि वहाँ पे फैमिली मेंबर्स को अलाउड ही नहीं होता है।
Mhm.
एंड यू विल नॉट बिलीव कि वहाँ पर जाने के बाद उनकी कंडीशन दिन ब दिन डिटोरेट होती गई, बिकॉज वो अपनी फैमिली मेंबर से नहीं मिल पा रहे थे, उनको कोई साइकोलॉजिकल सपोर्ट नहीं मिल पा रहा था। एंड अल्टीमेटली आफ्टर समटाइम्स वी लॉस हिम। तो साइकोलॉजिकल सपोर्ट ऐसा नहीं है कि दैट सेपरेट एंटिटी। अगर प्राइमरी फिजिशियंस हैं वो उनको साइकोलॉजिकल सपोर्ट दिलवाते हैं, तो जो आउटकम होता है जो मेडिकल प्रॉब्लम्स का, वो भी बहुत अच्छा निकलता है,
Absolutely.
कि जो रिकवरी प्रोसेस है वो बहुत अच्छा होता है। अगर साइकोलॉजिकल सपोर्ट नहीं है तो फिर वो रिकवरी में भी उसमें काफी प्रॉब्लम आती
Absolutely.
है। तो ये बहुत जरूरी है कि कोई भी अगर पेशेंट है, ये मान के चलिए कि अगर किसी पर्सन मेंटली अगर वो फिट है, मेंटली वो साउंड है, मेंटली हेल्दी है, तो वो मुश्किल से मुश्किल चैलेंजेस, उसके साथ बड़ी से बड़ी मेडिकल प्रॉब्लम क्यों नहीं है, वो उससे बाहर निकल आएगा। लेकिन अगर कोई मेंटली स्टेबल नहीं है, चाहे वो फिजिकली कितना ही ठीक हो, तो भी वो फिजिकली ठीक होने के बाद भी वो उतना प्रोडक्टिव नहीं हो पाएगा खुद के लिए, सोसाइटी के लिए, इन स्पाइट ऑफ बीइंग फिजिकली वेल।
Right.
तो मेंटली हेल्दी होना इज बहुत जरूरी है। मेंटल हेल्थ के बिना फिजिकल हेल्थ जो है वो बेमानी है, उसका कोई मतलब नहीं। दैट्स द होल पॉइंट।
Right, right. Quite a line. I like that last line. Bilkul. Vijay, let's have a quick
Yeah, sure.
conclusion from you, please.
So I just want to say two very quick things that, in English, there is a saying that the mind is a good servant, but a terrible master. And what it says to us is that it is possible for us to cultivate and to develop a certain mental strength, which Vinay has also been referring to and other people have also been referring to. So in Hindi, there is a very famous song that all of us know. हमको मन की शक्ति देना, मन भी जय करें, दूसरों के जय से पहले खुद पे जय करें. So while we sing this song and we say हमको मन की शक्ति देना, this मन की शक्ति is not going to come from outside. This मन की शक्ति is something we are going to have to cultivate, just like we cultivate कि हमारे हाथ में शक्ति है या हमारे शरीर में शक्ति है, हमारे मन की शक्ति के बारे में हम लोग क्या कर रहे हैं? And so my passing message to everybody is that please take charge and take responsibility for that mental condition and then get the appropriate support. There is a lot of support available, but without the individual participating in it actively and without the individual putting in the effort to cultivate that mental strength and that mental resilience to be able to deal with serious illnesses, long-term illnesses, chronic illnesses, it is not going to work. So
Absolutely.
that's what I'd like to leave as a closing thought with the audience.
Okay, great. Awesome. So now I'll just quickly recap. I guess what the takeaways have been for us is, as Kamal said, that we definitely need to have, protocols and standardized measures, which should be mandatory. It should be, integrated in the system, but we really have to work at it, at all the different conditions. और अपने रिसोर्सेज को यूटिलाइज करना है हमारे को, बहुत ज्यादा जरूरी है. और जैसे as Vijay said that केयर गिवर्स को उतना ही एम्पावरमेंट देना है हमें, क्योंकि बहुत समय उनके साथ हम बिताएंगे हॉस्पिटल के बाहर, और उनको भी उतना ही केयर चाहिए कई बार केयर गिवर्स को जितनी हम पेशेंट्स को चाहिए. तो ये सारी चीजें हमें एज द सपोर्ट सिस्टम, जो टीम है जो उनको देख रही है, उनको ये चीज देखना पड़ेगा. एंड आई गेस ओनली देन ये लॉन्ग टर्म केयर, मेंटल हेल्थ लॉन्ग टर्म केयर would be possible Otherwise, it will remain a far-fetched dream for all of us, and we'll continue to suffer in silence a lot of times. So I think with that, I will close the session today. And thank you, panelists. Thank you for being here, and hope to see all of you again.
Thank you
Thank
for
you.
inviting us, and I enjoyed the conversation. Piyush, Vinay, Kamal, and Dr. Singh. I enjoyed the
Thank you, sir.
conversation.
Thank you, sir. Same from our side.
Thank
Pleasure
you so
to
much.
meet you all. Thank
Yeah.
you.
Thank you. Bye-bye.
Bye-bye.
Good night.